be able to have the testing again at American Family Field. And for those who have been there before, the location of the testing site has changed a little bit. You will now go a little further east at the Yount parking lot, as they call it, for testing. Last week, we administered a total of 3,041 total COVID-19 tests. So there's still obviously demand for testing. If we need more, we'll add more. But we're still concerned about the rise in numbers that we have been seeing, and we'll review our public health order next week. Again, we are troubled by what we're seeing in terms of an increase in the percentage of people testing positive. And we want to make sure that we stay ahead of this pandemic. With beautiful spring weather, vaccination efforts underway, and loosening restrictions, it can be easy to forget the basics of fighting COVID-19. We are all totally exhausted from this. There is nothing fun about this whatsoever. But please remember the 3 W's when you're out in public or interacting with people outside of your household. Wear a mask, wash your hands, and watch your distance. We must continue to follow the necessary precautions to keep our community safe. We want life back to normal. So let's just stay with it until we can get life back to normal. And with that, I'm going to turn it over to the county executive. David.
Thank you so much, Mayor Barrett. Good afternoon to everyone joining us. I do have some encouraging news to share today, which is first, our Kosciuszko vaccination site, we have officially administered 10,000 doses to community members and Milwaukee County employees. And the other is that the Milwaukee County Transit System will increase its capacity limits from 15 to 20 passengers per bus starting Monday, April 12th. And when you think about this adjustment, it comes as a growing number of people in Milwaukee County are becoming vaccinated, and it aligns with phased reopening plans and relaxed restrictions from health officials. And the data shows that the rate of COVID-19 transmission is low on our buses, and allowing additional passengers on each of our buses will enable our transit system to better serve those who need reliable on-time transportation, whether they're going to work, school, medical appointments, pharmacies, grocery stores, and other important destinations. And this is in line with other cities as we begin to see more vaccines being distributed. And while we are making some progress, significant progress, vaccinating residents as quickly as possible, it is important that we continue working together to crush COVID-19 once and for all, even as restrictions are eased. And I want to remind everyone that masks are still required while utilizing public transportation, getting vaccinated, masking up and staying physically distanced, washing your hands and getting tested. These are all crucial tools to protecting ourselves and our families. So if you'd like more information on MCTS's response to COVID-19, you can visit ridemcts.com/coronavirus. And I'd also like to remind everyone that as the mayor mentioned, as of this past Monday, April 5th, all Wisconsin residents ages 16 and older are eligible to receive the vaccine. So if you have not scheduled an appointment to receive your vaccine, we want to encourage you to visit healthymke.com to use this vaccination site locator. And again, that's healthymke.com. This locator, it really shows you where you can go to get the vaccine and if an appointment is required. And it also has details about community vaccination events that will be taking place. And this is a crucial time for us, particularly as COVID-19 cases continue to rise. So I want to urge you all to continue wearing masks, washing your hands, and physically distancing when possible. This pandemic is still far from over, and the best thing that you can do to protect yourself and your community is to sign up to receive your vaccine as soon as possible. In order to mitigate the spread and the severity of COVID-19, we all must participate in all the safety precautions that we continuously talk about. And so everyone has a part to play in making sure that we can keep Milwaukee safe. And lastly, I'd like to highlight the We Care Cruise bike drive that began also this past Monday, April 5th, and will continue through May 5th. So if you have a bike that you would like to donate, you can bring it to any Wheel and Sprocket location during the drive. And if you need a bike, donations will be distributed on a first-come, first-served basis. And when you think about biking and staying active, both of them are extremely important when we think about both our mental and physical health. And as part of Minority Health Month, I want to continue to encourage everyone to take care of themselves by staying healthy, physically fit, and getting the vaccine. And with that, I'd like to hand it over to Dr. West.
All right. Thank you, Mr. County Executive. Good afternoon. First, to our numbers, we are currently seeing an average of 123 new cases of COVID a day and about 1 death every day. Our trends continue to gradually rise, and we've passed 5% positivity at 5.3% for our 7-day average. Our key indicator remains red for cases and yellow for testing. We now have 76 people hospitalized with COVID in the county, up more than 50% from just a few weeks ago. And with this week's update, for the first time, we saw a substantial downtrend in the number of vaccines administered in the county. So we'll certainly wait for lingering data to arrive before making any conclusions there, but this is absolutely not the time to pull back on the number of individuals seeking out or being vaccinated. As mentioned today, the Milwaukee County Office of Emergency Management Vaccination Site at Kosciuszko Community Center on the south side of the city of Milwaukee administered our 10,000th dose of vaccine. The county has certainly been honored to be a partner in the vaccination effort. And while our site does hold appointments for those in the most vulnerable and under-vaccinated zip codes in the county, we are open to anyone age 18 and older. And I just logged on right before this to check, and we have appointments available starting tomorrow morning. And you can register at covidmke.com, and you can see all the available sites in the county at healthymke.com. We saw yesterday that the B117 strain, or the UK strain, is now the most common source of infection nationally. And while this is certainly something that we saw coming based on what this strain had done in many countries in other parts of the world, it's still very concerning when we consider the increased contagiousness and the increased severity of this new strain. So to be clear, for those who are not vaccinated, this means that you are substantially more likely to become infected with COVID now through the same level of exposure as you would have had in the fall. And also to be clear, if you are infected with COVID now, you're substantially more likely to get severely ill, to get hospitalized, or to die. However, the good news is that vaccines, all the vaccines currently in the United States, seem to still work very well against this variant. And this is likely why we are seeing more severe disease in younger, unvaccinated people, and more young people being hospitalized. So whereas during our national peak of COVID back in early January, 53% of those hospitalized were over the age of 65. That's now only 35% of hospitalizations. We're seeing many more young people hospitalized today than we did back then. And this is likely due to our older population being more likely to be vaccinated and protected from severe illness, while the younger unvaccinated populations are being more affected by the illness and by the increased contagiousness and severity. So the take-home message here is simple: get vaccinated. If you're over 16, or if you're 16 and older, you're eligible. And if you're unsure, if you're on the fence as to whether or not to get it, now is the time to decide, before you get infected with the widely circulating new strain. And with about a third of our population having received at least one dose of vaccine, chances are that you know someone who's been vaccinated. So talk to them, hear about their experiences. Do research online at healthymke.com under the frequently asked vaccine questions, or talk to your healthcare provider about the vaccine. These are the sources for reliable information. The time to wait and see has passed. It's time to learn about the vaccine from reliable sources and make your own decision. Thank you, stay safe, and I will hand it to Health Officer Director Rausch.
Thank you very much, Dr. Weston. I'm Darren Rausch from the City of Greenfield Health Department, and it's my pleasure to join today to talk a little bit more about the data that we're seeing in Milwaukee County and talk a little bit more about the vaccination efforts countywide. So first, let me just start out by talking about some general trends and themes that you've certainly heard echoed here by other speakers today. We are continuing to see increases in cases throughout the county. And certainly, while increases are seen both in the suburban communities and in the city of Milwaukee, the increase is more pronounced for both the general population and for school children in the city of Milwaukee. Certainly, there's been a lot of attention also on school children and youth sports over the last week, and this has been a national media story jumped on and focused on by the Centers for Disease Control and Prevention. Yes, in our area here in Milwaukee County, we have seen increased cases among school children who play sports. Notably, as noted last week as well, we have seen local football teams have both cases and quarantines that have been implemented due to COVID cases. However, it's difficult for us to know if this is something sports related or school related in our communities because the numbers are still fairly small and there's a lot of overlap and interrelationship between school children in the school setting as well as on a sports team. The increases that we're seeing in Milwaukee County are certainly not unique as well. We are seeing these increases across the region and as well statewide. Today, for the first time in quite some time, the state of Wisconsin is reporting more than 1,000 cases today. I believe the number is 1,046 cases. And that's notable because for many weeks, about a month ago, we were seeing only a couple hundred cases a day. So all of this information, folks, is really about focusing on the mitigation strategies and doing what you can to keep yourself and your family safe by following all the mitigation guidance, following the 3 W's, and getting vaccinated whenever you can. So with that, I'm going to go ahead and share my screen and talk about the data and show you some of the trends that we're seeing in the data. On my screen now, we're looking at Milwaukee County daily number of cases, new cases, and you can see that the increases that we've been talking about for a few weeks are continued to be there. Again, these are slight increases, but certainly they are compounding on top of each other from week to week. And so the blue line is the 7-day average in the suburban communities. Again, a very gradual increase over the last several weeks. The orange line is the city of Milwaukee, so we see a little bit of a peak and a little bit of a downturn. And most notably, what we're concerned about is the additional cases here at the end of the graph that are right now pending because more lab results are coming in, and that's provisional preliminary data. So when we switch and look at the kids report, we see a very similar trend, but we see it a little bit more pronounced. Again, the orange line for the city of Milwaukee is much more pronounced. And the current 7-day averages are rates that we haven't seen since early February when we were coming down from the peak of cases in November and December. And even in the suburban communities, we're seeing daily case rate averages that we haven't seen for several months. So this is certainly something to watch very carefully in the coming weeks. Moving back to the county-wide report, we continue to reflect and see very high vaccination numbers in our older, more vulnerable populations, with very, very high numbers of people over 65 getting vaccinated. I believe that number in Milwaukee County is north of 70%. And so as a result, we see very few deaths in the recent weeks, and this is a very, very positive outcome of the strong vaccination effort that's been occurring throughout the community. Talk next about the reproductive number, and certainly this is one of the more concerning things that we've been tracking over the last couple weeks. The most recent data now that we're reflecting here shows a reproductive number under 1, so showing a squashing of the transmission of COVID-19. But you can certainly see here for much of the last 2 weeks, that reproductive number or transmission rate has been well north of 1, meaning increased transmission of COVID-19 in our community. So we're good now, but certainly we hadn't been good in this measure over the last couple weeks. And we can certainly see here in the city of Milwaukee, it was a little bit higher than the countywide average. And in the suburban communities, it was a little bit lower. So that's something we want to really make sure that we're doing all of the things to keep ourselves safe, to stop the transmission of the disease and drive down that transmission rate. We've talked at length about demographic trends over the last several months as well on media briefings. Again, while we're seeing increases, the increases aren't really easily teased out to say, hey, is it 18-year-olds driving this? Is it 30-year-olds driving cases? You know, what racial or ethnic subgroup? It really seems that we're seeing slight increases in all of the groups, and very difficult to see as we look in here, but you know, generally a little bit of an increase across all groups. And that's why it's very important for all of us to get our vaccine when eligible and continue to follow the mitigation steps. I want to talk about testing quickly, and I know Dr. Weston talked at great length about some of the trends we're seeing in percent positivity. Overall, countywide here, we see a very flat trend over the last 14 days, but we can certainly see that there has been a pretty noticeable increase over the last several weeks in terms of percent positivity. Testing is still available, and although our testing is plateauing more around 20,000 cases, please know that there's testing available throughout the community and in healthcare systems. And if you need a test, please go seek a test, because that's the best way to know if you've been infected with COVID-19. And then lastly, I'll just show the spatial map looking at where COVID has been hottest over the last couple weeks. Looking at the last 2 weeks, the areas in red is where we've seen a large number and a large rate of disease for COVID-19. Again, these numbers are smaller than we've seen historically, but certainly indicative of considerable amounts of spread. And we see that many areas throughout the county continue to reflect high rates of COVID over the last couple weeks. So in conclusion today, I just wanted to talk a little bit more about the vaccination efforts and reiterate some very important messages that you've heard previously on this media briefing. While all previously prioritized individuals and groups remain eligible, this week represents the first time that many Milwaukee County residents have become eligible. And I want to continue to point out that while vaccine availability is expanding, you may need to exhibit just a little bit of patience, because vaccine allocations throughout the county may not be as robust as they need to be. It's very important, as Dr. Weston mentioned, that if you're eligible for vaccination and you haven't been vaccinated yet, to really do your homework and study up on the vaccine. If you have questions or concerns about getting vaccinated, again, talk to a healthcare provider, talk to others who have been vaccinated. We have given millions of these vaccine doses both in Wisconsin and throughout the country. And vaccine is one of the best and most effective ways that we can move forward in improving our community levels of immunity in the hopes of bringing an end to this pandemic. I certainly want to encourage anyone who wants a vaccine to get one as soon as possible and as quickly as possible. And knowing that resources like healthymke.com provide opportunities for you to figure out where to get that vaccine, whether it's from a local health department, a healthcare system, or a community pharmacy. There are many options for you, many dates and times, and certainly avail yourself of all those resources to learn more about where you can get vaccine. Lastly, I want to talk to parents of children who are 16 or 17. I specifically want to remind parents that the Pfizer vaccine is the only one of the 3 vaccines that's available and approved for the use for individuals who are 16 or 17. Both the Moderna and the Johnson & Johnson vaccine are only available for those 18 years and older. So if you are a parent looking to vaccinate your older teen, make sure you're seeking a Pfizer vaccine. It can be very, very frustrating if my staff in the Greenfield Health Department need to call you and cancel out your 16 or 17-year-old from coming to our Moderna clinic or our Johnson & Johnson clinic. So make sure you're focused on Pfizer, and know that the reason you need to get Pfizer is because that is approved for that age group. And certainly while testing is occurring and research is happening to move the age range, right now, as of today, Pfizer is the vaccine for those 16 and 17. Lastly, it's Thursday in the first week of April, and I want to just say, not only is it great that baseball season is underway, but it's also Public Health Week. And as a public health professional, I need to note, both professionally and personally, that it's Public Health Week, and encourage all of you to appreciate and thank a local public health leader or somebody who works in the public health system for all the good that we've done. As I said last year in these media briefings, public health has more attention now than it ever has in the past. And really, the pandemic has underscored the important and good work that we do in the public health system, both in local health departments, but in healthcare systems, community pharmacies, and all of the partners that you have seen and heard from on media briefings, and all of the partners and participants that are helping in the COVID-19 pandemic, including those on this media briefing across city, county, medical college, etc. So thank you very much for your time and attention, and I'll turn the briefing back over to Sydney.
Thank you, Darren. Our first question comes from Joyce Garbasiak at WISN 12. Dr. Weston, maybe you can weigh in on this. With so many appointments available, is there a fear you've already reached everyone who wants the vaccine, meaning a big part of the population may not be interested in getting the shot?
Sure, I can take an initial response here. So I think while we're seeing certainly a lot of the most eager vaccine recipients having perhaps already received their doses, there still seem to be many people in our community who want vaccines. So when you look at a recent national survey, the data showed that 60% of the overall population have either received their vaccine or want to get it as soon as possible. 60%. And so considering that only a third of our county has received at least one dose, it would suggest that there's still many people out there in Milwaukee County who want to be vaccinated. And I think that's where the Healthy MKE website is so helpful. It's a quick and easy source to find vaccine near where you live or where you work. Now, those same survey results also showed that nearly 20% of the population falls into this wait and see category. So this is the group of people that Director Rausch and I were talking about, where it's so important to take that time now to learn more about the vaccine from reliable sources. And I really think that when you talk to your healthcare provider, you talk to people you know who've been vaccinated, or you look online at reputable online sources, you'll find that the benefits of the vaccine outweigh any perceived risk of the vaccine. So I think there still is room for more people that want the vaccine to get it.
Our next question comes from Chuck Hornbach at WUWM for Mayor Barrett. With cases still going up, why did the city okay tailgating at the American Family Field parking lots? Why is that safe?
Well, the health department approved the plan that had been submitted by the brewers because I think they ultimately decided it probably was safer than having no policy whatsoever. What we were hearing reports of is bars being overcrowded and people going into bars where they would have more exposure to more individuals. But by having the tailgating in the single vehicle where people who are going to be seated in the same pod tailgate together, we felt that it was actually potentially safer to do it this way. So it was an understanding that this is something that is a tradition at the ballpark. We understand it's a tradition. It's a popular tradition. But under these controlled circumstances, the feeling in the health department was this actually could be safer than having no policy whatsoever, where people would meet somewhere else, do their tailgating, get exposed to other individuals, and then come to the ballpark.
Our next question comes from Courtney Sisk at WISN 12. Taking into account the UK variant and that younger people are getting COVID and hospitalized, is there a concern with in-person school? Will there still be discussion to recommend going back to remote?
So I think data on the new variant, the B117 variant, and how it affects children is really just starting to emerge. So following that data and certainly acting accordingly will be important. What we do know is that the best way to protect our children, to protect those who are not yet able to get vaccinated, is to get vaccinated ourselves so that we do not unknowingly pass disease to them and that we can minimize the overall burden of disease in our communities. So the best step right now is for individuals who can get vaccinated to get vaccinated, and we'll certainly continue to follow the research and the data on children and the new strains.
Our next questions are from Allison Durr at the Milwaukee Journal-Sentinel. What is the city's rationale behind opening appointments at the Wisconsin Center for 3-day windows? Are there any concerns this could make it more difficult for people to sign up for an appointment by forcing them to return to the website multiple times? How will people know where the city is in any given window, i.e. whether new appointments have opened yet or when they are going to?
Well, first, let me say we know it's not a perfect system, and we continue to fine-tune it to the extent possible and make variations so that people will have as easy access as possible. But the intent here is actually to make it easier for people to sign up for an appointment by giving them by using the 3-day window, if you want to call it that. But the one thing I would stress right now, more than anything, the loudest voice that I want to use in this podcast, if you will, is that there are spots available that people should be, whether it's the Wisconsin Center, whether it's North Division, whether it's South Division, please take advantage of the opportunities right now and sign up or walk into one of these locations, because I've talked to people in other states that have had more difficulty than we've had here in Wisconsin in getting the shot. So we are in a good place, relatively speaking, compared to other states in our vaccination distribution, and we want people to take care of it. And to the point that Dr. Weston was making, I think there is still demand out there. I've talked to many people who want to get it, and this falls in a number of different categories. There are people who wanted to wait and see, and so now people are seeing that people have gotten it and it's safe. There are people who naturally don't race to the front of the line and they have busy lives and they're waiting. But I want to stress that we will get life back to normal the sooner we have more people vaccinated. And that, I think, is everybody's goal.
Another question for you, Mayor Barrett, from Allison Durr. You said Milwaukee now has sufficient vaccine supply to meet the needs of the city. How many first doses per week does that amount to? And how was it determined that the city now has enough?
Well, I don't have that number in front of me, and I'm sorry that we don't have someone from the health department here, but it's literally thousands a day that we have access to now. And a lot of the increase came as a result of FEMA's decision to have the site here, where they have a number reserved for the FEMA location, but they also have a significant number reserved for our north side and south side locations at North Division and South Division. But the easiest way for me to describe it is, again, there is availability right now for people to get the shot. So that's how we know we have enough vaccination right now in the city.
Our next question is from Courtney Sisk at WISN 12. Several summer festivals have canceled. Irish Fest is still working through a plan. Is the health department working with them? What might a festival in a pandemic look like in terms of health safety?
Well, any major event is going to have to work with our health department. And so I'm certain that if they are planning to move forward, that they will be meeting with our health department officials to make sure that it's done safely. So different organizations are approaching this differently, but in every instance, there will have to be a safety plan that will be approved.
Another question for Mayor Barrett from Victor Jacobo at CBS 58. Mayor Barrett, can you expand on how you will evaluate and determine if the current order needs to be revised next week? What is the likelihood stricter capacity limits will be put back in place for businesses like bars and restaurants?
Well, one of the things I'm proudest of for the city of Milwaukee over the last 13 months now is that every decision we've made has been based on science. And we have a very transparent system for making these decisions where we look at the different indicators. And if the different indicators are going in the right direction, that allows us to loosen the reins a little bit. If they're going in the wrong direction, unfortunately, that's going to require us to tighten them. I am concerned that they are going in the wrong direction. They have been, although when Darren Rausch was talking about that rate being lower than 1, that was great news for me to see that. I think that's a reversal of what we've seen over the last couple of weeks. But we will continue to follow the different indicators that we have put in place. And that's when we'll decide how to make those decisions.
Our next question is from Allison Durr at the Journal Sentinel. With more children being hospitalized, what does the supply of pediatric ICU beds look like locally? Are there any concerns on that front? And is treating COVID-19 in children any different from treating the virus in adults?
So treating children is always different from treating adults. And this is certainly true with COVID as well, where illness in children can come not only from the acute or initial stages of the illness, but also from MISC or multi-system inflammatory syndrome in children, where they have disease weeks or months after the initial infection. But that is rare, and we're lucky in Milwaukee County to have outstanding family medicine physicians, pediatricians, pediatric specialists, as well as a world-renowned children's hospital. But as for capacity, not only do we have capacity at our hospitals, but we have hospitals and health systems that have worked together closely since the very beginning of the pandemic to be prepared for any surge that should come.
Thank you, Dr. Weston. Our next question is from Sari Lesk at the Milwaukee Business Journal. Does Milwaukee have sufficient supply to meet demand because supply has increased or because demand has slowed down?
I would say it's primarily because because the supply has so dramatically increased, and we've been able to keep up with the demand. But again, I'm very thankful to the state. I'm very thankful to the federal government because they have dramatically increased the supply of vaccinations that we are receiving. We're literally getting tens of thousands a week right now.
Our next question is from Joyce Garbasiak at WISN 12 for Mayor Barrett. How long do you anticipate FEMA running the Wisconsin Center site? What more can the federal government do to help local efforts?
Well, we'll continue to be in cooperation and communication with the FEMA. Certainly, I'm hoping that we'll stay here as long as the demand is there. They've been very, very good to work with. And so, again, I'm very, very thankful. So I think that the federal government over the last several months has really stepped up its game. And I think, quite honestly, I think it's because the president has made this his priority. So we have had a lot of cooperation and coordination. The federal government was good last year, but now I think it's really accelerated its efforts.
Another question from Sari Lesk at the Milwaukee Business Journal. Much of the vaccination effort appears to still be centered on websites, including instances of people showing up in person or calling hotlines and being directed to a website, which they may not know how or have resources to navigate. How are local vaccinators working with people facing trouble with all the online systems to get an appointment?
We continue to have community work done as well. As I mentioned in my initial comments, we are going to be at several public housing locations this week as well. And so we recognize there are some people who don't use the internet as much as others. Yesterday, for example, I know that we had a mobile team that was over at Repairs of the Breach. And that's a location for people who have a lot of housing challenges, many of whom are homeless. In those instances, what we've been doing is relying more on the Johnson & Johnson vaccines because we find that people who are very, very transient, it's better to allow them to get that one-shot vaccine. But we have a very proactive, concerted effort to reach those communities who don't rely either on the internet or on telephones.
Yeah, I just want to add quick, Sydney, from the local perspective, and I can speak to my health department and many others in the area, websites are often the easiest thing to advertise and the easiest thing to get out there. But I certainly know my staff and many local health departments still operate phone lines where people can call in. They can call into the general line. They can stop into the office, and we're happy to make an appointment for them on the online system. Certainly understanding the challenges and the difficulties if somebody is not computer literate or has limited access, but certainly navigating in a number of different ways is certainly very important to get people connected to vaccines.
Our next question is from Chuck Hornbach at WUWM. Mayor Barrett, any worry about Cubs fans coming to American Family Field next week and there being more potential for COVID spread? I understand that capacity at the stadium is lower.
Well, I'm always concerned when Cubs fans come to Milwaukee. My preference would be that they just send their money here and we can distribute it to restaurant owners and to the team. But I think that right now, having the capacity limitation in place, which is not that different from the capacity limitation that you're seeing for the Chicago ballparks, I don't foresee that as being an issue right now. Again, we have the rules in place. They have the rules in place in Chicago. And so as long as the Brewers, who have been very, very good at this, continue to exercise the safety protocols, I think we're going to be fine.
We have just one additional question in the chat at this point. If there are any other questions, make sure you get them into the chat. This question is from Courtney Sisk at WISN for Dr. Weston. Is there a possibility child care centers would need to shut down to stop the spread?
I think it's too early to make any assumptions on how the new strain in particular will affect children and whether it'd be more transmissible with children. So we'll continue to follow the trends, continue to follow the data, and continue to share it here.
That appears to be the final question. Last call for questions from the media. All right. Thanks everyone for joining us today. We'll see you back here next week on Tuesday.
Thank you all.
Thanks, everybody.
Thank you.